Salam Rafiq Turing Joseph McKellen, MIQUELON, patient of Kenneth Levy. Dear Kenneth, I saw Dear Kenneth, thank you very much for referring Mr. McKellen to my office. Paragraph, reason for consultation, COPD, hypoxemia, comma. Paragraph, this is a 72-year-old gentleman with history of chronic dyspnea and cough with sputum production. He has had symptoms for the last 5 years. He's been diagnosed with COPD. He's HOMO2 dependent for the last 2 years period. A recent hospital stay at Thunderbird Hospital was noted. Records have been requested period. He complained of sputum but denies any hemoptysis period. Dyspnea is moderate to severe and interferes with his activities of daily living. He thinks that despite taking multiple inhalers, he's still quite incapacitated, period. There's no history of chest pain or asthma, period. Other symptoms include hoarseness and rhinitis. He complained of nasal obstruction and drainage. He also has chronic leg swelling and chronic venous stasis, period. He has poor dental condition, period. He has skin atrophy and gets bruised easily, period. He denies any chest pain. There's no fever or chills, period. He has chronic fatigue, period. Denies vomiting or abdominal pain, period. He has chronic joint pains due to degenerative arthritis, period. He denies any history of snoring or apnea, period. There's no history of parasomnia, period. Paragraph, past history. This includes COPD, hypoxemia, chronic venous stasis, and rhinitis, period. He is on HOMO2, period. He had hernia repair and tonsillectomy, period. March of 2008, he was at Thunderbird Hospital for pneumonia, period. He has childhood history of whooping cough, paragraph, medications, HOMO2, Advair, Pro-Air, Spiriva, Theophylline, folic acid, Mucinex, period. He's now switched to Pulmicort and Brovana, SVN, period. Social history. Social history, he's retired. He was an accountant and worked in an office. He denies any occupational exposures, period. He does consume some alcohol on a regular basis, period. He has smoked for 55 years, 2 to 3 packs a day. He quit smoking. He has finally quit smoking, period. Family history. One of his siblings had myelodysplasia. His aunt had diabetes, period. Exam, 95% sat on 2 liters, weight 228, height 5'11". HENT, mild nasal congestion and postnasal drip is seen, no JVD. Chest, decreased breath sounds, mild kyphosis, period. fine crackles in both lung bases, period, no wheezing, period, cardiac regular rhythm, S1S2, extremities, hyperpigmentation, both ankles, and chronic edema. Paragraph, spirometry, FEV1 38%, 1.24. FEV1 38%, 1.24. World capacity 67%, 3.04. Peak flow 35%. Flow volume loops show flattening consistent with severe airflow obstruction. Period. This could also be consistent with bronchomalacia. Period. Patient has a 23% increase in FEV1, indicating a asthmatic component. Period. Paragraph. Records from Thunderbird Hospital have been requested, and I will review them once they are available. Paragraph plan impression. Paragraph impression. Advanced COPD with hypoxemia. Period. Patient is on HOMO2. Period. His spirometry shows severe airflow obstruction and asthmatic component. Period. There's also possible bronchomalacia noted on the flow volume loops. Period. He has finally quit smoking. I agree with the current medical therapy as outlined above. Period. Patient also has a significant asthmatic component and will benefit from inhaled steroid therapy. Period. Number next, chronic rhinitis. Period. This is most likely multifactorial. Period. There may also be a component of chronic sinusitis. Number next, chronic venous stasis. Period. Patient has chronic leg edema and very likely has chronic venous insufficiency. Number next, poor dentition. Number next, plan. As above, comma, in addition, I will also obtain routine lab data, which will include arterial blood gas and a alpha-1 antitrypsin level. Period. Additionally, comma, I think he will also benefit from treatment with prolonged antibiotics therapy such as Zithromax 250 milligram daily for 30 days. Period. This would target the probable chronic infection component with chronic bronchitis and chronic sinusitis. Period. I'd like to see him again in 1 month for reevaluation. Thank you very much for this referral. Sincerely, Sophie.